Good morning, everybody. Today we will talk about nasal polyp or nasal polyposis. But initially, we will talk in short about the nasal anatomy. Then we will go for the nasal polyp. So, nasal anatomy consists of two parts: external nose and nasal cavity proper. So, external nose is formed by partially by bone, partially by cartilage. The bony part is formed by nasal bone and process from maxillary bone and a process from frontal bone. After that, some part is formed by cartilage. The cartilaginous part is formed by two cartilages. First is the upper lateral cartilage and the second is the LR cartilage or lower lateral cartilage. So, external nose is made above by nasal bone and the two processes which are frontal process of maxilla and nasal part of the frontal bone. This is the bony part of the external nose. The lower part is formed by two cartilage which are hyaline in nature. These are the upper lateral cartilage and the LR cartilage. LR cartilage is two parts connected by a thin rim of cartilage. This is a lateral view of the uh, nasal. Here we can see this is the nasal bone. This is Here we can see this is the nasal bone along with that this is the maxillary bone. This is the nasal process of maxilla. The white part over here, which is having a cross marking, is the nasal part of the frontal bone. This midline is septal cartilage. That is the upper part of the septal cartilage. This green is the upper lateral cartilage. This violet colored is the lower lateral cartilage or the LR cartilage. As I have told you, LR cartilage has two parts which are connected by thin rim. So this is the major portion forming the ala of nose. Rest is a fibrofatty tissue at the lower end of the nasal cavity or the anterior nares. Now the blood supply of the external nose. The skin of external nose is supplied by ophthalmic artery, which is branches of the ophthalmic artery. Also, the skin of ala and the lower part of the septum is supplied by branch of the facial artery. Here we can see the facial artery is giving branch to the superior labial and columnar artery, which is supplying to the columella and the lower part of the or the anterior inferior part of the nasal septum. Also to the tip of the nose and lower part of the ala. Similarly, ophthalmic artery branches are giving blood supply to the dorsum of the nose and other part of the external nose, skin over the external nose. So this is the blood supply of the external nose. Now we will discuss the nerve supply of the external nose, that is the skin. over the root of the nose is supplied by the infratrochlear nerve supplying to the root of the nose, and the lower half of the nose is supplied by the external branch of anterior ethmoidal nerve and infraorbital nerve. This has a importance in clinical aspect, as if we go for surgery of nasal cavity under local with sedation, we should give local block to the anterior ethmoidal nerve as well as infraorbital nerve, so that when you manipulate the nasal cavity from externally, the patient is properly sedated and does not feel the pain. So, skin on the base of the columna is supplied by the terminal branch of palatine nerve. So, local block at these three levels will always help you to do manipulation of the nose during the surgery. So, what is then? We have discussed the external nose in detail. The other part of the nasal uh, cavity is the nasal cavity. Of the other part of the nose is the nasal cavity. Nasal cavity is divided into two parts, right and left, by a septum, which is partly bony and partly cartilaginous. Each nasal cavity, that is the right and the left, has a roof, has a floor, has a lateral wall, and the medial wall. The medial wall is formed by the septum. Roof is formed by sphenoid bone, which contain sphenoid bone as well as ethmoid bone. So it has cribriform plate of ethmoid, nasal process of frontal bone, nasal bone, and the sphenoid bone. From posterior to anteriorly, the arrangement is like sphenoid bone, then the ethmoid bone का cribriform plate का part, then nasal process of the frontal bone, then the nasal bone proper. This forms the roof. So, floor, that is the bottom part, which is formed by the palatine process of the maxillary bone, horizontal process of the palatine bone. These two parts fuse and they form a plane which separates the nasal cavity from the oral cavity. So, the floor is the part which separates oral cavity from the nasal cavity. Now, the third wall is the lateral wall. The lateral wall is the wall which is where three folds laterally that are called the turbinates. Each turbinate has a space below which is known as the uh, con which are known as the meatus. So, superior turbinate, middle turbinate, and inferior turbinate. Below those are the superior meatus, middle meatus, and inferior meatus. This lateral wall is formed by ethmoid bone, maxillary bone, lacrimal bone, and inferior turbinate bone or concha, part by sphenoid and palatine bone. Also, now we will talk about the medial wall. Medial wall is formed by septum or the septal wall. It is formed by partially by cartilage and partially by bone. The cartilaginous part is the septal cartilage and some part by columnar membrane. Rest is formed by perpendicular plate of ethmoid bone and vomer bone. This is the diagram showing the cartilaginous part and the bony part of the nasal septum. So in this diagram, we can see how the roof is formed. From anteriorly, this is the nasal bone, then frontal process of nasal or the frontal nasal spine of the frontal bone, then nasal process of frontal or the nasal spine of the frontal bone, then the cribriform plate of the ethmoid bone, and posteriorly there is a sphenoid bone. So this is how the roof of the nasal cavity is formed. This diagram, in this diagram, we can see how the floor of the nasal cavity is formed, and it is separating the nasal cavity from the oral cavity. So the floor partially it is formed by palatine process of maxilla and partially by horizontal plate of the palatine bone. When these two parts fuse, this hole forms the hard palate of the oral cavity, or this will form a separation between the nasal cavity and oral cavity. Now the septal part, as I have told you, it is partially cartilaginous and partially bony. So the blue part is the septal cartilage or the quadrangular cartilage. The this greater alar cartilage is forming the columnar part or the small part of the columna. Then there is perpendicular plate of ethmoid, vomer bone, also rostrum of sphenoid is also there. So all these things get together and form a septum in between the right and left nasal cavity. So septum is partly cartilaginous and partly bony. Now the blood supply of the nasal septum. Nasal cavity proper is mainly supplied by sphenopalatine artery, but there are various other arteries also which is supplying to the nasal cavity. But here in this diagram we are discussing the blood supply of the nasal septum. So there are four major arteries which are forming and supplying the nasal cavity, nasal septum. That are sphenopalatine artery, posterior ethmoid artery, anterior ethmoid artery, then superior labial artery, branch of facial artery, and also greater palatine artery. Remember, out of these five arteries, the anterior ethmoid artery, superior labial artery, greater palatine artery, and sphenopalatine artery, these arteries make a plexus in anterior-inferior part of the septum. This is known as Castle plexus. This is the main source of epistaxis in children and young age people. In old age, the person usually gets posterior type of epistaxis. This is the bony structures present on the lateral wall of the nasal cavity. Here we can see it is formed by ethmoid bone. Ethmoid bone forming uh, superior and middle terminates. Inferior terminate is a independent bone in itself. So parts and along with that, some part of the lateral wall is formed by maxillary bone and some part by sphenoid and palatine bone. So this is how the lateral wall of the nose is formed. As we have discussed it in the diagram, we can see there are three bony projections from the lateral wall of the nose, which are known as turbinates or concha, that is the superior concha, middle concha, and inferior concha. Superior and middle concha or middle turbinate and superior turbinate are the projection of ethmoidal bone, and inferior concha or inferior turbinate is a separate bone in itself. But in some cases, there are four concas. This is a very rare condition, but it is seen in some of the cases. This fourth concha is, or the turbinate is also known as supreme concha. Each turbinate has corresponding meatus below and lateral to it. So the area below to the turbinate is known as concha, meatus. So superior meatus, it has air cells in it that are the posterior ethmoid air cells. In middle meatus, there is opening of the maxillary sinus, frontal sinus, and anterior ethmoid sinuses. In inferior meatus, there is opening of nasolacrimal duct, and sphenoethmoidal recess, there is opening of sphenoid recess or sphenoid sinus. This is important because as we will discuss the pathologies of the sinuses, we will be able to distinguish between the site of origin of the disease depending from where or which meatus is affected initially, so that we can locate the sinuses which is initial cause of infection or the disease. So openings in the nasal cavity, we can see this is the lateral wall diagram. This is the superior meatus. The posterior ethmoid air cells open in the superior meatus. This is the middle concha or the middle turbinate which has been cut and removed. Here we can see there is opening of the frontal and anterior ethmoid frontal sinus opens in the middle meatus. Anterior ethmoid air cells open in the middle meatus. Also, maxillary sinus open in the middle meatus. Now, the inferior meatus, the inferior turbinate has been cut, and we can see the inferior meatus. In the anterior one third, there is an opening, which is opening of the nasolacrimal duct, which is guarded by a wall or Hansen's wall. This is the opening of the nasolacrimal duct. From the eyes, the lacrimation or the tears that travel to the inferior meatus. Now the blood supply of the nasal cavity, as I have told you, major blood supply of the nasal cavity is done by sphenopalatine artery, which is a branch of maxillary artery. Always remember there are various branches, 5 branches I have told you which supply the nasal septum, but major blood supply of the whole of the nasal cavity is done by sphenopalatine artery. The sphenopalatine artery is also known as the artery of epistaxis. Now the nerve supply of the nasal cavity. Nasal cavity is supplied by anterior branch of the V1 branch of the so the nerve is the nasal cavity is supplied by the branches of the anterethmoidal branch of V1, that is the ophthalmic branch of trigeminal. Similarly, a nasopalatine branch of V2 that is from the maxillary branch of the trigeminal. Some part by the posterior nasal branch of V2, and also olfactory epithelium is supplied by olfactory cranial nerve, which pierces the nasal mucosa by cribriform plate of the ethmoid. Now the lymphatic drainage, the lymph from the nasal cavity drains to the upper deep cervical lymph node, that are the submandibular lymph node and the upper jugulodigrestic and retropharyngeal lymph node. So upper deep cervical lymph node is the main site of drainage. So infection in the nasal cavity will cause enlargement of this lymph node. Now the paranasal sinuses. These are the air-filled structures present at the lateral and superior or the around the nasal cavity. These are lined by pseudo stratified ciliated columnar epithelium. The cilia beads the mucus blanket in a particular direction so that the mucus is excreted out from the sinuses. So the sinuses are divided into two groups, that is the anterior and posterior group. In anterior group, it is mainly anterior ethmoid, the frontal sinus, and the maxillary sinus. In posterior group, it is sphenoid sinus and the posterior ethmoid air cell. Sometimes sphenoid is separately taken as a third group, which is present posteriorly. Now we will discuss the maxillary sinus. It is also known as the canna sinus of Hugh. So it is the largest paranasal sinus with a capacity of 15 milliliter. It's found in the maxillary bone. Anteriorly is the facial surface of the maxilla. Posteriorly, it is the infratemporal fossa and the pterygopalatine fossa. Medially, it is middle and inferior turbinates, and the roof is formed by the floor of the orbit. Also remember, posteriorly or the floor is floor of the maxillary sinus is formed by the alveolar and the palatine process of the maxilla. The second sinus is the frontal sinus. It is present in the frontal bone. It is the second largest sinus. As it's an asymmetrical sinus. Here in X-ray, we can see the two right and the left, which are separated by a interfrontal septum. The anteriorly, it is formed by the frontal bone and the skin over the frontal bone. Posteriorly, it is the anterior cranial fossa. Inferiorly, it is the roof of the orbit, and there is also the opening which is present in the floor of the frontal sinus. Then medially there is a septum which is separating from the other frontal sinus. So interfrontal septum is the medial part, and all the walls are been covered. Now the next sinus is the sphenoid sinus. Here we can see this is the sphenoid sinus. This is the sphenoid sinus. It is present in the sphenoid bone. So superiorly there is pituitary gland, optic chiasma, and olfactory tract. These three structures form indent in the roof of the sphenoid bone. So the clinical importance here is that transnasal pituitary surgeries can be done through the sphenoid sinus. Similarly, anteriorly, sphenopalatine foramen is there, and sphenoid crest as well as nasal cavities there anteriorly. Inferiorly, there is nasopharynx and choana. Also remember, the median nerve travels in the floor of the sphenoid sinus. Similarly, posteriorly, there will be basilar artery and brainstem. Laterally, cavernous sinus and it contains like internal carotid artery. So, the cavernous sinus containing the nerves and the internal carotid artery are present laterally to the sphenoid sinus. Now, the ethmoid air cells or the ethmoid sinus, this is the air cells which are present inside the ethmoid bone. So, ethmoid group is divided into two parts. First is the anterior, the second is the posterior. The anterior ethmoid cells are large in number but the size is small. Similarly, posterior ethmoidal cells are lowest in number and they are pyramidal in shape, apex pointing towards posteriorly towards the sphenoid. Similarly, the roof is formed by the anterior cranial fossa of sphenoid ethmoid hair cells. Post laterally, it is the orbite separated by lamina papracia. Medially, it is the nasal cavity, and posteriorly, there is sphenoid bone. So, what are the functions of the nasal cavity? That is, breathing is not a function, but it helps in maintaining humidification of air, temperature regulation of the inhaled air. Also, it will filter out the dust particle, pollens, bacteria in the nasal cavity. That is the filtration of the air. So, it protects the lower airway. Also, remember, as there is olfactory mucosa in the superior part of the nasal cavity, so olfaction is also one of the part. Nasal resonance or the vocal resonance, some words which have a nasal tone are being used, and also nasal reflex is one for protecting the airway. So air conditioning is the filtration and temperature regulation and humidification of the inhaled air. So the mucus covering the turbinates, the sinuses, they all cause increase in the surface area of the contact of the air, inhaled air. Protection of lower airway. This is done by air conditioning of the inspired air, mucociliary function. Respiratory mucosa is coated with a mucus blanket which contains lysozyme enzymes. So, if the bacteria is inhaled, it will stuck in the nasal mucous membrane by mucus sheet blanket, and this mucus blanket has lysozyme enzyme which will cause degradation or destruction of the bacteria, so protecting the infection from the air to go in the nasal cavity. Also, it has IgA or the secretory type of immunoglobulin in it, which causes binding of the bacteria and immobilizing the bacteria. Similarly, cilia of the respiratory epithelium beats the mucous blanket towards posteriorly towards the pharynx. This also causes sensitization of the Walder's ring, and this will aid as in development of the immunity in the future. Similarly, sneezing reflex will help the coughing out of the or the removal of the obstruction in upper respiratory tract along with removal of the foreign body too. Ventilation and drainage of paranasal sinuses. Inspiration creates a negative pressure in the nasal cavity, thus sucks out air from the paranasal sinuses. Similarly, expiration causes positive pressure in the nasal cavity, thus the air is pushed in the ostiums. Mucociliary clearance helps in the drainage of the paranasal sinuses through their respective ostium. So, nasal resistance. Nasal resistance is to expired air uh, keeps the positive pressure and it does not let the alveolar collapse. The factors affecting the nasal resistance are age, nasal cycle, exercise, respiration, posture, nasal reflexes, and skin and air temperature. These all affect the nasal resistance. Now, the third function is the vocal resonance. So, as I have told you, some characters are used in nasal tone. In some diseases, when there is occlusion of the nasal cavity or connection between the pharynx and nasal cavity is occluded, then we get a hyponasal voice. This is called rhinolalia clausa. It occurs due to obstruction in the nasopharynx, like enlargement of the adenoids, or when there is congenital absence or occlusion of the posterior nares. Gynolalia aparta is hypernasal voice. It occurs due to abnormal communication between the oral and the nasal cavity in such cases like cleft palate and palatal paralysis. The fourth function is olfaction. As I have told you, there is an olfactory epithelium present in superior roof of the nasal cavity. This area acts as a sensory part and the olfaction or the sense of smell is there. This is the pathway how the epithelium mediate the sensation of smell from the air to the brain. That is the smell, the smell or the chemical causing the smell get dissolved in the mucus. This causes sensory change in the olfactory epithelium, which is a modified neuroepithelium. This neuroepithelium they transmit the signals to the glomerular olfactory bulb. From glomerular olfactory bulb, the nerve fibers will travel in olfactory tract to the olfactory trigon, to medial stria, then hypothalamus, and central connection, that is amygdala and the hippocampus. Here we can assess the type of the smell or what the smell is of. Nasal reflexes are the protective reflexes for the removal of the foreign body or expulsion of the nasal mucus which is irritating foreign body which is irritating the nasal mucosa is been removed using sneezing. Also, large amount of secretion which has been collected in the nasal cavity sometimes get be removed through sneezing. Now we will discuss nasal polyposis.